Friends and family, welcome to another live broadcast brought to you by Premier's Turning Point, with your host, Bishop Dr. Uton Lane, and co-host, Overseer Franklin Williamson. We pray and hope that something that is being said today will bless your soul and spirit. Please take a quick moment to like and share this broadcast with your friends and family. Thank you again for joining us. Let's go into our live program.
Blessings, blessings, one and all. This is Bishop Dr. Lang. It's so good to be with you. We know we've been away for a couple of weeks with various things, but we're here. We're live today, and our plan going forward to be live with you 3 weeks out of the month. The third Saturdays we will be not live because of our other programming, but we're really excited that we can join up this evening. We want to pick back up kind of where we left off, which of course is the COVID crisis and pandemic, and we want to spend some time this evening just kind of updating you, with all of the various parts that are moving, between reopening, between vaccination, between testing, between it's just, constant movement. The CDC one day say something, the next day something else. So we want everybody to kind of be updated. And so we're going to do that as well as we can today. We hope everybody will, like our program, share with your friends and neighbors so they can, get the information that is out there, which is so needed, with what's going on. It's so needed. And we want to make sure that you all are getting the updated information. So we thank you for joining us. And as we said, please like and share, and let us just have a wonderful time where we're giving out all the necessary information that is needed. So God bless you. I'm going to have Overseer just have a few words to get us going, and then we will go from there.
All right. Thank you again, audience. Thank you for tuning in. We are live, as Bishop said. Welcome, welcome. We are still providing update on this COVID-19, especially as it relates to the reopening and the new CDC guidelines. I myself will share with you what my church will be doing. As you know, we did a phased opening, and we were told the mask can be removed, but we're going to look at how we can do that in a way where we don't cause this virus to create a third wave. So we want to listen in. If you have your pastor, just share this podcast with them, have them tune in. I'd love to have them even ask questions. We are now, 15 months into this COVID-19 situation, and thank God, we two pastors have collaborated, worked well together, and we have shared some best practices. And yes, there's some things that we did we no longer do. There's some steps we made that we had to correct, and we want you to learn from our mistakes and also learn from what we have found to really be productive as it relates to getting the church back into full operation in the sanctuary. So thank you. Tune in, share and like, invite someone to join this session today. COVID-19 update. Yes.
All righty. All right. So where we are right now is the pandemic is still raging. If you look at a global mindset, it's still raging all over the world. Here in the U.S., we are doing a little bit better right now because our vaccination rate, the latest I heard, was up to as much as 60% have probably gotten their first shot in the 2-shot series. And then overall, I think it's under almost 50% have gotten their second shot. So we're getting there. Remember, keep in mind that to have herd immunity, we need about 70-80%. So don't think we're there yet. So we're not there. So there is still some precautions that have to be taken. And there is some changes for people who are fully vaccinated, and different states are rolling it out at different times. So I'm going to just make some general statements. Overseer is going to kind of tell us about New York, and also more particular with what he's doing with his ministry. and then I'm going to pop back and then kind of pull it together. But in general, if you're fully vaccinated, the word from the CDC is now you can be outside without a mask. Outside. If you're fully vaccinated and you're with other fully vaccinated people inside, then you can opt to not wear a mask. Again, hear me well, because people are telling me there's a confusion. There's no confusion. If everybody is fully vaccinated, I'm not mean with 5 people vaccinated and another 5 not. No, if there's 10 people in a room and all 10 are fully vaccinated, then the recommendation is that you can go without a mask. Now, if there's anybody who is not vaccinated, then the recommendation is that everybody wears a mask, basically to protect themselves, and most so to protect the person that is not vaccinated. Now, churches are going to have to make some decisions about, are we going to have 1 year for vaccinated, not unvaccinated? All of that issues we have to now work out. So these changes have now just made it so that we have even more work to do to try to figure out. The best case scenario is if everybody in the church was vaccinated. But we know there's some people who are saying they want to wait, some people who are still saying they don't want to have it. So there's a lot of, permutations and computation of the whole. So we're going to have to try to figure out what is the best way for us to reopen, the best way for us to, start getting back into things. For example, I think it's now safe if the majority of your family is vaccinated that you can get together outside. I would still distance. It's still the recommendation if there's anybody in the group who are not fully vaccinated. So that really is the hooker and the whole thing right now. If everybody's vaccinated, hey, we can just, go to normal. However, if everybody is not fully vaccinated, we have to still take various precautions. And it depends on if you're indoor, outdoor, if you are in a big group, a small group, even at the big stadiums, we see what they're doing is, they're having, they're actually having 2 groups. If you're vaccinated, you go here and you people can sit, only about 3 feet apart and closer. While if you're not, they're putting you on the other side, and those people have to be 6 feet apart in a mask and all of that. So we're going to, over the next few weeks, we're going to see a general rollout, differences, different changes. Some are going to, be all, okay, let's go with everything off versus, precautions depending on what your group makeup is and what is the thing. Still large crowds, they're still recommended masks, and especially if they're inside. All right, Overseer is gonna give us some update on what's going on in his area, and then we'll come back after that.
All right. Yes. Great. And that's a good segue in. How do we go about doing that as far as, getting the new CDC guidelines where, according to CDC, if you're fully vaccinated and you are among folks who are also fully vaccinated, and what do we mean by being fully vaccinated? As you know, the one shot is the Johnson & Johnson. We have the Pfizer and Moderna, which are double dose. So after the second dose of the Moderna and the Pfizer, 14 days after, then you will be fully immune. So therefore, that's what we mean by fully vaccinated. Likewise with the Johnson & Johnson. Now, here is what we are discussing in our ministry. We currently have 2 in-person services, 8 o'clock and 11 o'clock. Now, we thought about leaving up to the honor system where someone would say, well, Pastor, I'm fully vaccinated. And as such, I'm not going to wear my mask. Okay. And we were okay with that for a little while, but there's some kickback saying, well, Pastor, we need to be certain that that person is fully vaccinated. So what we're going to roll out is a phased approach. Come July 1st in New York City, July 1st, the city is wide open. So we're using that as a marker, right? Just in time for July 4th. No surprise, right? So our 8 o'clock service, we're going to require folks during the month of June to show us their vaccination card, and we will log that. And they will be allowed to attend our 8 o'clock service. That will be a no mask service. where only folks who are vaccinated will attend. Now, we also discussed, then what if I'm vaccinated and I would like to wear my mask? Okay, that is perfectly fine. There is still a level of comfort that we will allow you, but the requirement is you must be fully vaccinated. Another question came up. So, what if I'm not vaccinated and I still would like to come and I will wear my mask? Well, as you heard Dr. Bishop Lang says, that the CDC is not recommending that you have this co-population with or without mask. So our center is not big enough to have some folks on the west wing, on the east wing. We don't have that square footage. So we have to split the services. We have been doing 2 services for many years now. So then we're going to phase it in like that. For the regular 11 o'clock service, it's going to be fully masked. Whether you're vaccinated or not, you will still be required to wear your mask. Now, we're hoping that this will learn from this. We'll have not many kickbacks. What we're also recommending is that members get tested very often, at least twice per week, especially now that we're opening up and we're increasing the crowd, let's say back to full capacity. You want to get tested regularly. And this way you can be certain that you are not contagion. So that's kind of what we're doing. Now, let me talk to what's happening in New York State and in New York schools. The governor, along with the mayor, they are trying their best to get to herd immunity. That's 78% threshold. Right now, they're at 60, so they need 18% more. Also, they have learned that in the younger age, 12, 16, 18, is where they are carriers of this virus. So if we can make sure they're vaccinated, then the chances of a third wave is at the very minimal. So what they're doing things like lottery. Your name is entered into a lottery. You get a ticket and 10 names are drawn on a Wednesday. And if your name is called, you win the lottery. They're also doing 4-year scholarship. They're also going directly on campus where the people are, setting up vaccination station to vaccinate the students before they leave the dorm and head back home. So New York City, and I think the rest of the country is trying to do their due diligence. The third thing they're doing, they have created this mobile bus that will actually get around to the neighborhoods. And folks with disability, folks with mobility issues, don't have a car, they really don't move around, pull that bus up within the neighborhood and target those folks and get them vaccinated. I'm encouraging pastors. I've been listening to a few, and encourage your saints when you look at the numbers. And before I mention the pastors, let me just pull up the most recent numbers. And these numbers are coming directly from the Johns Hopkins University. And as you know, they are one of the major trackers of the COVID-19 numbers. And when you look at this number worldwide, it really startles the mind, and it definitely warrants us to pay attention. Let me read the numbers, and I'm going to read, this is the global number. Now, as far as global cases, and these are cases that are recorded, 169,624,573. Pause for a minute. 170 approximately million cases across the globe. Now, global deaths, 3,526,265. That's 3.5 million deaths. That is the population of Jamaica. That means an entire island, an entire country has just been evaporated. And then as far as the global doses that I've administered of this vaccine, whether it's the Moderna, whether it's the Pfizer, whether it's the J&J or the ones out there in Australia. Now, this is not 1 million, but 1.8 billion, 306,625,725. So 1.8 billion doses of vaccine. I'm glad to see that run rate has surpassed the death rate. As you know, our new president made it his duty that within the first 100, there will be 100 doses vaccine. Now, in the first 100, he surpassed that and had over 200,000 Americans been vaccinated. So, pastors, you know, many have had less of our members in our congregation, and it's different when it's in your own house. And I say to a couple of my saints, when you look at your medicine chest, there are quite a number of medicines that you take on a regular basis. And if you go see your doctor, he or she may prescribe something new, and there is no hesitancy. Your hesitancy comes in, let me take it and see what happens, right? And you know it's not fatal. Now, what I didn't report to you are the deaths as a result of those who were vaccinated. And I'll get that number. I guarantee you it's less than the hundreds, right? And when you look at that, you can say then the vaccine is really doing a good job. Now, everyone, yes, we're unique in our body type, in our body makeup, with our mobilities, and whatever morbidities, whatever illnesses we have. And that's why we encourage you to really sit with your primary care physician. Some needed the shingles shot before and had to have that run through the body first before they take the Pfizer shot. Fine, do what's required. Some require to wear the mask until their systems are fully ready for the doses. Fine, but don't start saying it's the mark of the beast. Some are saying that if you take a magnet and run across the injection site, you will see that it attracts because there's a chip in the fluid. I don't know who really spent time to propagate such propaganda, but I want the church and the people of God to know that it is well tested, it has been well vetted, and now even Pfizer and Moderna are trying not to move from the emergency authorization, but just to get that regular authorization that everyone can gain access to this vaccine. So that's my update, just my update. If there are any questions, please shoot them out into our chat. We want to hear from you as we go forward. And we'll talk about education and what they're doing also. But so that's my
Yes,
update.
we will come back to education in just a little bit. And for the more specific guidelines from the CDC, if you have been fully vaccinated, then as a overseer rightly said, 2 weeks after your second dose in a 2-dose series, such as the Pfizer or Moderna, then you're considered fully vaccinated. And 2 weeks after a single dose vaccine, such as Johnson & Johnson, or of course you have the AstraZeneca in the other countries, then you're considered fully vaccinated. Now, so once you're fully vaccinated, you can resume activities without wearing a mask or physically distancing it, except when you're required by federal, state, or local, tribal, or territorial laws, rules, and regulations, including local business and workplace guidance. So even though you're fully vaccinated, you need to be aware of their local regulations, if there are any, and then, act accordingly. So you're in a state that still requires a mask for everyone, then you are required to do that and such alike. So you need to know where you are, what state, which state you're in, and what are their recommendation and the regulations that you have. If you have a condition or taking medication that weaken your immune system, you may also not be fully protected, even if you have been fully vaccinated. So keep that in mind. So talk to your, again, healthcare professional, as mentioned, your primary doctor or any other doctors you have about, your positions. That if you've been fully vaccinated, you can resume activities. That I said, you can resume activities without wearing a mask or staying 6 feet, except where it's required. If you travel in the United States, you do not need to get tested before or after travel or self-quarantine after travel. You need to pay close attention to the situation at your international destination, however, before traveling outside the US, because various rules are still in effect depending on what country you may go to. You do not need to get tested before leaving United States unless your destination requires it. So you have to check with where you're going to see if you need to be tested. You will still need to show a negative test or documentation of recovery before boarding an international flight to the United States. So if you're coming from another country to the United States, you're required to show a negative test or documentation of your recovery if you've had it. You should still get tested 3 to 5 days after international travel. And you do not need to self-quarantine after arriving in the United States, except from any particular countries. If you've been around someone who has the COVID-19, you do not need to stay away from others or get tested unless you have symptoms. However, if you live or work in a correctional facility, in any other facility that you're around a lot of people, maybe churches and stuff, you may still want to be tested, even if you don't have any symptoms, if you know you definitely have an exposure. All right, what you should keep doing. For now, if you have been fully vaccinated, you will still, if you have been fully vaccinated, you still need to follow guidance in your workplace and your business. If you travel, take the steps to protect yourself, get any required testing. You should still watch out for symptoms as well, especially if you have been around someone who's sick. If you have symptoms of COVID-19, you should get tested and stay at home and away from others. Keeping in mind that there is a percentage of people who have been vaccinated that still have been positive. So it's possible, depending on a lot of reasons, which we've gone through before. It could be a timing issue. It could be, your immunosuppressants, a lot of issues. So just you need to know that. So we know that COVID vaccines are effective at preventing COVID-19 disease, especially severe illness and death. And COVID-19 vaccine reduce the risk of people spreading COVID-19 as well. It doesn't eliminate, but it reduces the risk significantly. And, we're still looking and learning. We're still trying to figure out how effective vaccines are against variants of the virus that causes that. And early data show the vaccines may work against some of the variants, but could be less effective against others. So that's something to keep in mind. How well do the vaccines protect people with weakened immune system, including people who take immunosuppressive medications? Some of that is still being worked out. How long COVID-19 vaccines can protect people? They're still working that out as well and come up with what they think they're leaning to about a year, but we will see. As we know more, the CDC will give us more updates, and it will, enlighten us. Now, the reason I kind of focus on those who are vaccinated, because if you're not vaccinated, you're still under a lot of those rules that were put into place, where you need to have, you need to wear your protective equipment. You need to sanitize. You still need to do all of those things. So really, the important thing, as we're putting out there, is that people be vaccinated. We still know that there's some hesitancy among various groups, and all we can say is get educated, get all the information that you can, and therefore you can make an awesome and a well-educated decision. So with that, I'm going to go back to overseer to kind of update us with what he knows going on in the school systems and such like.
All right. Yes. School systems from the K through 12 and then from the college level. New York City mayor has declared that this September coming, there will be no distant learning, 100% in-person classes. However, the union is still stating that there might be a need for some remote learning for students with disability. There's some argument on that. However, there is definitely a shortage of teachers. And there has been quite a number who have seek early retirement, some who have decided due to their present health condition will not take the vaccine and as such will not return to the classroom. And since remote learning is not being offered, then there is a loss of a resource there. So there's a shortage. So we have now till May, June, July, August to really ramp up on covering the staff. Because as you know, there was hybrid. You will have some students who work in cohort. You would actually be in person and you'd be taught by a teacher who would be doing remote. Now, everything is now for the colleges are taking a step further. They're requiring vaccination, right? They're requiring that all students and staff are vaccinated. And they're working on the numbers, on the data to see if there was at least an academic slide. What they know for sure is that the grades may have shown an increase, which means that the students on their transcript, on their report card, are faring much better. Now, if they're given an in-person exam or an in-person assessment, the fear is they may not be able to master the content because most were just pretty much using the technological tools available to them to respond to the questions being given. And nothing is wrong with that. But we pray and trust that as they are fishing the answers from the internet, that they too will actually learn something. So there is that perceived gap that need to check in. As you know, for K through 12, maybe about 30% or so parents opt in to take the exam, and they only offered session one. Session one meaning just multiple choice. And many of our students don't fare well on multiple choice. And multiple choice is pretty much binary. You either get it right or wrong. But when it comes to the short responses or the extended responses or the essay, that's where now our students may have the opportunity to gain some additional points. So not just a test to use as a measure of a metric of success. Look at the total portfolio. So there's some major work going on. The other big area which not discussed much in the news, but I hope it get out there. I hope our union rep and the union president look at it, is the evaluation. How do we evaluate teachers? The rubric and the framework is archaic. It's pre-COVID and still expecting the teachers to do what they do. They need anchor charts. How are you going to do anchor charts when you got a virtual environment going on? They still need full participation. The student refused to put their camera on, and that is being measured against the teacher. Now, they're failing to realize that there's some children who are home and multiple students are home, multiple devices. So therefore, it's not conducive to be on camera, So there's a lot of things that need to take into account. And why are the teachers being required or being penalized? Let's use that word for the students not being on camera. So they need to step back now and look at how we're going to create a new framework to evaluate teachers' practice, their pedagogy, evaluate students' learning and understanding. And this post-COVID has caused a change in every area of our lives. And I want us to really step back and look at how education can be different in the 21st century post-COVID. So that's kind of what's happening in schools. Again, parents are still on the fence with their children. Should they go? Should they not go? They're not vaccinated. Why am I requiring my child to go? So there's a whole lot of questions. But they're hoping that during calling it out now that September it's no virtual, then they can have the discussions, have the town hall meetings, whether virtual or in person, and get the public's input and come up with a viable solution. So parents, please don't sit back and wait for September. Now is the time to write to your counselor, write to your representatives, write to your principal, write to your chancellor, and make them know some of your concerns.
Very good. And I think that's a very good point. I think parents and grandparents, whoever is taking the children, got to be proactive. Because
Yes.
if not, we're going to come September and you're going to like, okay, what am I doing with these kids now? Are they in school? They're out of school? Physically, what's happening? How am I going to juggle this? I think a lot of the jobs are opening back up. So
Yes.
therefore, a lot of people are going to have less opportunity, I think, from working from home. Yeah, because for most part, the jobs are going to be start requiring everybody in. So if you're going to be going in, and definitely what you're going to do with the children. So it's definitely a time to look at that whole thing and see where you stand and do you need any assistance, any help, any direction, and reach out. Now is the time to reach out to get that information. And so I think to keep all of that in mind is going to be very, very important. I think one of the things that I see happening is they're going to be probably getting the approval for using the vaccine all the way down to the lowest age pretty soon. I think that's going to be really the next step that we're going to see over the next month or so. And hopefully, and I think that's the hope that maybe by August, a lot of these children would have the opportunity to at least get one shot before getting back to school. I think that's kind of the rabbit hole I think where I see us going down. And I've been, looking at it and watching the data and seeing where that is coming from. And I think it's very clear that that's some of the plan. And I think that's one of the reasons why some of the states and governments are just saying, this is what we're going to do. Now let's just make it happen. So I think as the people of God, we have to, of course, make sure we are going along with the rules and the regulation. And if we have any objections, we need to make sure we get them clarified so that we can make an educated decision about whichever way to go. So, I mean, I know there's still quite a few holdouts in church, out of church. Quite a few people are still, on the fence, as they say. But, I think this is time for people to really look at themselves, look at the facts, and then make a decision. I don't know what you think about that, Overseer.
No. I'm saying we got to shake the fence, right? You got to be on one side of the fence.
No, you can't be. You got to make a decision. Which side of the fence. Mm-hmm. That's going to be a message, the next message coming up there, Overseer. Which side of the fence you're on?
Side of the fence one, it's, folks are getting comfortable, but here's what I do here. And, they're waiting for some divine message, some divine confirmation, from the Lord to really, it's no more medical. It's no more factual. It's more spiritual now. The Lord has to tell them that they should take this vaccine. And some of might say, I will not take the vaccine. But what I see also happening is the workplace, the jobs now are stipulating that their employees get the vaccines. So there's not many places you're going to go in the near future where you can avoid confronting that without wearing the mask. So I think given 15 months now, 14 months in, I think we have seen enough. I've just read the statistics of how many deaths, how many contracted the COVID, and I know many who are saying I'm not taking the vaccine now feel that because they have contracted the COVID-19 virus, they have some antibodies. So speak to that then, Bishop. If we
Yeah,
contracted COVID, why do I need this vaccination?
yeah. The wording on that is they're not so sure how long the antibodies from just contracting would last. They still don't know. So their thought is when you get the vaccine, you get a super boost in your immune system. So you're going to be like more than protected, even more so. And I think if we can get a cohort of people that are well protected, then you see how it would lead then eventually to everybody being covered. So I think those people who have had the disease and recovered and therefore have antibodies. Yes, there's a little bit more comfortable feeling, but you cannot know for sure how long these antibodies are going to last. So that's why they're still recommending getting the shot. You're going to get a super boost and probably get a much longer coverage period than if you were not vaccinated. So I think everybody should just look at the bigger picture of having enough antibodies around that you can warn off this disease if it just try to hit us with another wave. And I think that's an important point that you brought up is that we see in the countries that have had a second wave that like India is going through right now, it's devastating. So you would want to be able to, if those people were vaccinated, then we would not have this same depth of destruction that we're seeing there right now. So it's really behooves everyone to get the facts, get vaccinated, and then we can move on and move up. It's amazing that I think we're going to see more of this coming down in terms of restrictions about what you can and can't do if you're not vaccinated. I know everybody's scared of that. Oh, dare anybody tell me what to do? But I think that is where we're heading, and I personally think it's a good thing that you get all of that in place, get yourself covered, and then you can more likely open up and get into the other things that you would want to have for pleasure. So we want everybody to look into that and make a decision. That's how it is.
So, Bishop, I got a question here.
Yeah.
Why, if you are vaccinated and I am not, and I'm wearing a mask, it poses a risk? I'm not
Well,
vaccinated, you are, and I'm wearing a mask. Why does that pose a risk?
I think that would be actually okay. Say the if the but again, what the problem is, you have to worry. And actually, I'm gonna hit you on that again. We have to worry
Hmm.
about the honor system. The honor system, So I think what it is more like people, saying technically, if I am vaccinated and you're not, you're wearing a mask. You should be. That's good protection. All right. But I think the other part of it is, they're still looking into that. And we're seeing more and more where if you are vaccinated, you may not be spreading, but they're not absolutely sure that you couldn't then spread that. So the person, wearing a mask, and remember, wearing a mask is still not 100% to prevent spread. And so, but say I am vaccinated and I'm running around yelling, screaming, yes, you have your mask on, but if an overwhelming amount of stuff is in the air, you potentially can be exposed, especially if you're in close proximity. Remember, wearing masks does not negate you needing to distance, depending on what environment you're in. It's not like it takes over. Yes, you could maybe distance a less amount if you were all vaccinated, but if you're not, then they're still recommending that 6 hours, 6 feet. And what we're seeing is that a lot of time people, especially churches, they're going back and they're not necessarily adhering to that strict rule. So that's why I think you need a mask, especially in church, because people forget. As I mentioned to you guys the last time we are on, I happened to go to a funeral, and not most of the people that were speaking, when they go up to speak, they took the mask off. The one person who was moderating didn't have a mask on the whole time. And the team that went up to sing took their masks off. The dancers, they didn't take their masks off, but they were hugging the bereaved family. So people drop their guard and don't, protect. And then I did get word, that quite a few people that were at the funeral came down with the virus. So it's still out there. You still got to be careful. You still got to take care of yourself. You still got to take whatever precautions is necessary. And even when, you're doing that, you're still, with the viruses are hanging around, there's still a risk of getting infected. However, the risk would be less.
I think, Bishop, I think that's the clincher there, the key there. It's still, there's some novelty, or, being novel in that they're not sure having the mask and being around someone who is vaccinated, how does that work? And the church setting is not like a workplace. The church setting, we're in an atmosphere where it's closed. Two, we are vocal. We have to use our vocal cords. We're singing, we are shouting, we are giving God the praise. And when someone compares that to their job and says, well, we can go to work, why can't we go to church? I don't think that's a fair comparison, because at work you see a cube, you're either on the phone, you're not really talking to your coworker, you're busy working in your little silo. Unlike church, we are a community, right? We are worshiping, we're lifting our hands, we are, exalting the Lord. It's a whole different behavior than going to. So I hear that as a defense. If you go to work, you can come to church. But at work, they got all these different aerosols, all these different equipment, all these different ventilators, all these different filters that are cleaning the air. And that doesn't happen in the church. So
I agree.
So I still see churches, running the aisles, still laying on hands, still hugging, still doing the tarrying and all that kind of stuff. And the COVID virus is still present. But they would look at me and saying, Pastor, where's your faith?
Yeah. But I think it's not, I think people lose sight. It's not a faith thing. I always was, as we've been talking over the week, is trust me. I think to have faith and believe and trust God would more so lead you to, in my opinion, to actually wear the mask and do the things, because I'm saying I trust God. He has given me this way out that I can actually prevent. And therefore, and I still believe that if I'm doing all of this and I'm one of those small percentage that may still come down with the virus, God is able to deliver me. He's able to keep me, and he's able to see me through. But why should I, say, all right, if I see a building right now, if you see a building on fire, I mean, everybody's been out, there's no babies left in there, there's nothing ever to do. But I'm saying, well, hey, I trust God. I can just go in this fire and, the Lord is going to protect me. Is there anybody on that would do that? I don't think so. So this is the same thing. This pandemic is raging. All right. And we have a way to, to stay out of it by using the mask, by distancing, by sanitization, and by, making sure the air that our quality is good. So why shouldn't you do that? To me, it's downright almost silly to say, all right, I'm going to not do this. And then they're the same ones who now, when they come down with the virus, they're saying, they're the same ones saying, well, what happened? But I can tell you what happened. You didn't do what you needed to do, which, God has given us the knowledge. He has given us the people with the knowledge. And therefore, he has made a provision, for that we don't have to succumb to this. So I think is that mindset and that frame of mind, that kind of thinking that is plaguing a lot of us. And the part of it is a lot of people are doing it out of this God. They don't realize it, but out of this pride, I am a child of God. I'm a proud child of God. Yes, you are. All right. But you need to humble yourself to the will of God and humble yourself to, the rules and the laws. I mean, the Bible is clear about that, and follow them. And then, my thing is, if now after I do that, I come down. Actually, we've had quite a few people, between family and that, contracted on their job, even though they were trying to protect, but you're not sure. But they all recovered. Do I know people that did not recover? Yes. All right. But for the majority, I've recovered. And we prayed. We believed that God was going to bless them. My mother-in-law was 92, I think, came out of it because God is right there. So I think God is able and our faith is strong in the Lord. But we don't have to be presumptuous and say, okay, I'm going to toss myself in the fire and Lord, you better save me. You know?
So, Bishop, being in the medical field, and now that we are at least more than 10 months in, are they gathering data about the after effects of those who contracted COVID? And do they really fully recover? Does
Uh,
COVID leave some fingerprints? Does COVID leave some scars? Does COVID leave? Because I'm talking to a few of my friends who, I know this gentleman. He's a great orator. I mean, when he speaks with power and anointing. And ever since the COVID, he has now got a gasp for breath. He can't go a full, strong, powerful 5-10 seconds without taking a deep breath. I mean, do we really 100% recover? I mean,
great question. Great question. And the answer is a percentage recover 100%. Because not a percentage have some mild symptoms that last forever. Some people, the cough they can't get rid of. The shortness of breath is there. You're right. And then there's a percentage who have severe long-term effects. Like
wow.
now I'm on oxygen forever. My lung has been damaged adequately that now, I have to be on oxygen constantly. And I can give you tons of those. Or now something happened with my heart and I have to be on these medications now for my heart as a result of me having the COVID. Or, I did have a blood clot as a result of the COVID. And, I got part of my lung damage and I have to be on oxygen, which I mentioned again. So there are a certain amount of people who have chronic long-term effects. All right, so that's how the reason my thought is why take a chance and get it. Yes, the Lord even bring me out. I didn't die, but now I'm on oxygen. Now I have to switch my job. I'm now disabled because of the COVID infection and now all the things that I can't do and I can't engage in. So that to me is not an argumentation to realize that if we can prevent by being vaccinated, why shouldn't we? Because even though you're a child of God and you got COVID and yes you didn't die, but you have some now long-term chronic effects.
Okay, I think that's I'm hoping that they're tracking that and can report to
Yes.
the public the percentage, right? Those who are
You're
chronically
You're
right, because
definitely
that's
going to see that data, yeah. That data will be coming down pretty soon. And I'm sure they're working on that and tabulating it so that you can see. Because I think one of the reasons, and that's a really good point. That's one of the areas I think have not been emphasized enough, that people realize that there are effects of COVID that don't go away, or there's effects that you don't even know and may not go away, but it knock you down so much that then you now have another problem. Somebody, for example, who have say you have already had an underlying heart problem, and you get this, your heart got worse, now you have a kidney problem. I mean, it's almost a cycle of the things that can happen and are happening. And I'm thinking, I mean, you're definitely going to hear a lot of that with the sequela of COVID and what some of the symptoms and some of the problems that people are left with after that.
okay.
Yep.
Okay.
hmm Yep.
So
So we're in for the long run. We're not
yeah,
out of it yet. And I think people need to understand that. hmm
yes, because I think that will just help to educate. Because some folks are very analytical, they're very, objective in their decision making, and if they really can see those numbers, that may be the tipping point to get them off the fence, get them to take the vaccine.
Mm-hmm.
because and whatever we can do to help. So if there's any stats there, bring it to bear. Any questions
Yeah.
came in there?
No, I didn't see any yet. So I think we're being very thorough and kind of clear. So people are kind of just sitting back and listening. So, which is also a good thing. But we want to make sure that we're covering everything adequately for everyone out there. So if you have a question or a comment or a suggestion, please put it in the chat or in the comments on the Facebook and or on the YouTube, and we'll more than likely be able to answer those for you. So I think the key point, as we're kind of making today, is that yes, we're coming out of the crisis in the U.S. at least, not all
Yes.
over the country. Right now, there's another whole thing of countries battling to get doses because of that AstraZeneca availability, because the surge has been so bad in India, and they're keeping that for a lot of their people. They were the main suppliers of a lot of the third world countries. And I did see a big article this week about the infighting that is going on there to get access to the
Yeah.
vaccine. So consider yourself blessed because you're in the U.S. and then you're blessed and you said I don't want it. And here's people clamoring all over the place. They're not as blessed as you are. They said, get it to me, give it to me, give it to me. So I want people to really consider this. And the other point somebody else brought out earlier to me this week, which I didn't think about, is don't think the government is going to pay for this forever. All right? Right now, this blitz there, it's free. A few months down the road, you may hear that, okay, you have to go through your insurance. And trust me, you know how those insurance companies are. Some of them not going to want to pay for it. So especially if it's from emergency use, they're not going to pay for it. So I want people to also realize that you may be selling yourself short. And when you're ready for it, you may have to fork out the dollars to pay for it.
Yeah, I kind of said that, Bishop, when I saw where Pfizer came out the gate and was asking for this normal authorization, not the emergency.
Yeah.
So I can see now where the insurance company start waving their hands. We can start writing prescriptions for this now, and see what's your co-payment and so on and so forth. So yes, I don't think the government will be paying that for too long. And let's hope we get to herd immunity quickly, before the season.
Because I think the last bill that there was signed, with all of these things that it was in that bill. I have to look up and try to look it up for the next time when that bill ran out. It wasn't forever. And you can be assured, trust me, remember underlying here, we're talking about a capitalist country, right? So everybody's going to be, how can I increase my get my returns on my capital here? So Pfizer and all of them, they're getting paid right now from the government. The minute the government say, all right, we ain't paying, you're going to see a major charge for this vaccine. So that's, and again, thank God for one of my patients pointed that out to me this week, said, hey, doc, they're not going to be paying for this forever. I just said, that's what I try to tell my family member, get it now while it's paid for. So that's all I thought. Mm-hmm.
There's going to be a delicate balance with the surplus vaccines versus the time when the government stopped paying for it. Because then when that surplus is a major profit.
Oh, yeah, definitely. It's kind of like the gas stations, things change, and the gas was in their tank, right? But everything, and then they charge you for the increased price for what's in the tank. Shouldn't they empty the tank first?
Absolutely.
No, that's not how it works. That's not how it works.
And the cars weren't being driven on the road during a couple of months. So where all that gasoline went, right?
Yeah, well, basically, actually, if you notice, the price of gasoline went up over those couple of months because remember, it's supply and demand. If demand is listen, if you have surplus, it doesn't really do you that much good. The prices are still going to go up because that supply and demand has to balance out. So people, be ready for some. Right now, the cost of food is so high. I don't know if you're into the supermarket lately over Sierra. You probably don't do that, but
no, Bishop, my wife doesn't do that.
Okay, all right. All right then.
And
So
I'm
let me. Yes.
my cart is lighter.
Yeah. 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 I actually
Yes.
went with my wife. I went with my wife the other day because I'm trying to be now more available for stuff like
Oh,
that, and it's amazing. I'm like, $150. What did we buy? And I definitely there was no gold in the cart. But a little stuff, and it is so. So listen, a lot of that is a result of the pandemic, because you have to remember now, all of the things that closed down, and even when they reopen it, right now a lot of the places cannot find workers. That's a
and, that,
crisis right now, and
and
therefore they did this. Mhm.
that's another discussion about not finding workers.
Yeah,
We got to
and then
discuss.
yeah, well, definitely, and then therefore the supplies of the stuff is less. The
Yep.
demand now is greater because everybody's out and about now in their shorts, right? Everybody's out and about, and so here's the demand, here's the supply. What's the difference? Prices go up. So
Yep.
listen, we just have to rely, and so that's one of the reasons why I think also we want to get this thing under control as quickly as possible to get things back to normal. So even your pocketbook needs to get back to normal, because
Yep.
of the outgoing amount. So we want to just keep on giving out awesome, great information. We're going to probably change our format of our program a little bit over the next weeks. We definitely
Yes.
will have an update section, and we'll update what is most relevant and going on. And so I'm sure COVID is going to dominate that segment for a while. We may shorten our program a little bit, take a break, and then do a current event. So everybody get ready. And if anybody, any particular thing you would like to hear about,
Yes.
feel free to put in our chat, go to our church Facebook site and putting a comment there. We'll be willing to tackle whatever issues that are facing you. All right. So anything that we're not talking about that is an issue that you may need some help with, feel free to reach out to us and we can give you some information on that stand. Overseer, any last words for today?
Yes. And I just want to echo what you said. Listeners, please be active, a participant. Let us know what's on your heart. Let us know what topic, what issues you'd like to discuss. We'll definitely bring it there, bring it to this program, and we will wrestle with it. We'll make sure that our listeners are informed. The Bible declares our people are destroyed because of lack of knowledge, ignorance, and we want to dispel that ignorance. We want to be that candle that illuminates that dark pathway so you can know how to navigate as you traverse this planet called Earth. So, yes, let us know what passion, what desires you have, and we will put a program right around that. So thank you for tuning in. Continue to subscribe, continue to share and like, and let your friends and family know. We're on same time every Saturday at 6. You're welcome to be a part of us. God bless you. Back to you, Bishop.
Yes, we thank you all for joining us today, and hopefully you gathered something. The pandemic, thank God, is on the downturn in the U.S. All right, and we are trying to be upbeat and be uplifted in all our ways, our thoughts, and everything. So we want to rely on God for our deliverance and for our help, but also the Lord is going to help those who help themselves, and He has given you ways to help yourself. Help yourself now and let God have His way. God bless you, and we love you. Blessings, blessings, blessings.
Turning Point family, what an awesome time we just had. To all our first-time guests, we truly appreciate you for joining our live broadcast. We would like to hear from you, so please send us your comments, questions, or testimonies of how this program has impacted your life. Our email address is info@pflmi.org. Finally, if you feel led at any time to give to this ministry, please visit us at pflmi.org and click on the tab for donations. You can also give via Cash App at $PFLMIORG. We're looking forward to meeting with you live on next week's program. Have a blessed and prosperous weekend.